Good morning, everybody, and welcome to the first seminar presentation of 2013. We are very, very happy to be kicking off with Dr. Larry Frank, who is faculty here at the School of Population and Public Health and who has a very long history in understanding the built environment, and especially on understanding how the built environment impacts public health. And that's what he's going to talk to us about today, especially regarding some really new developments in the field. So we're very pleased to have him. Thank you, Larry.
Thank you, Sarah. Good afternoon, everybody. It is now afternoon. Thank you for all taking the time to come and listen to my talk. So I'll be chatting about about 10 or 15 years of research on the evolution of our understanding of the way we design communities and the places we live and how that, and where we work as well. We need to do more research on our work environment and our health, and we're starting to think more about how to bring the built environment part into that. We've done some of that over the years. So I'll be talking a little bit about this research. I'm in SPPH. My office is on the 3rd floor, and I work in the environmental occupational health stream, along with Hugh, who's here, and Karen Bartlett in the back. And Sarah's, I think, got her PhD out of that stream, and Ed is here as well, part of our stream. So we're all excited to be part of SPPH. And I'm a little bit even more of a odd participant in the sense, or faculty member, because I'm a transportation planner, a landscape architect, and urban design. I have my PhD is Urban Design and Planning. So how many know about the School of Community and Regional Planning at UBC? You guys familiar with us at all? So basically I'm cross-appointed, which is an interesting cross-appointment really in applied science. And I think that connection is really important. And many universities around the world are seeing this as well as key, because there's no question the way we design and make environments affects people's health. And that was pretty much ignored for a long time. In fact, urban planning has its roots in public health. As you may know, in the late 1800s, in most cities, conditions were terrible. Health conditions were really bad, in particular exposure to air pollution, and many of the things that some of you study were so bad that there had to be a response. And that's where urban planning started, was actually creating regulations and creating a whole discipline around the ways that the environment affects health. A guy named Frederick Law Olmsted. How many have heard of Olmsted? So what did Frederick? Where was Frederick Law Olmsted from? And what do you, when you think of who raised, you did raise your hand? What did he do? Absolutely, he's really Olmsted and his after Olmsted, his predecessor, those that followed him. I can't remember I always get that, protégés. His son, I think, and his nephew followed in that legacy, and he was a sanitary engineer for the city of New York, but he also was the father of landscape architecture and also started the first planning program at Harvard. So he really got the importance of having open space and recreation in cities and how people need it. And he actually took that word. If you read about Olmsted, you'll see that he actually dissected the word recreate to mean to recreate, to be able to have time, that people living in urban conditions, very stressful conditions, especially in those days, needed to have a place to go to kind of decompress. And so that's why Central Park was so important, to create a quality of life for people, and understood that fundamental necessity. As many of you may know, tenement housing in the late 1800s often sometimes had no windows, had no cross ventilation. These were called railroad flats. Anybody ever heard the term railroad flats? So that it created a lot of reform and policy. So urban planning really came out of public health. So it's kind of a natural fit for me. Fortunately, I'm not 150 years old, so I wasn't there to see it. But anyways, a little bit of background. So I'm going to talk today about some of the research that colleagues of mine and I have been doing on this topic. And I'm actually going to include a little bit on vegetation, because we've been really working on, many of us, Mike Brower, who's also in our stream on the 3rd floor, and environment, and other faculty. I have a PhD student as well, Emily Rugel, who's working on this topic. A lot of us are really interested in how that public open space and green space affects health in a positive way, and how to bring some of that back into the way planning's done. So I use this graph a lot. Some of you who've heard me talk may have seen this. I really like it because now our energy source, it's really health, environmental impacts such as greenhouse gas, and energy in food is all starting to merge. So you can think about, a piece of pizza is food for food for thought, but in general, food is our transportation fuel as individuals so that we can be active in our travel patterns. So how to use that energy efficiently? Well, we can walk. This is a bit of a metaphor, but let's say roughly, and it was from the US, so it's in miles, but walk about, maybe bike 10 miles. So biking, as Kay knows, obviously is the most energy efficient form of movement that we really have. Maybe some people argue maybe the unicycle would be slightly more efficient, but a little bit more difficult to balance. So we use 2 wheels. We could walk maybe about a third that distance on the same amount of energy because we can't roll. Or we could take a car about 100 feet. So that's where I often start off, is thinking about, from an energy efficiency perspective or a greenhouse gas perspective, we're really talking about active transportation or transit where we move multiple people with the same vehicle. So that's really the orders of magnitude of difference in energy efficiency for movement based on the same unit of energy going in is really critical. And that's why we're in the situation we're in, where we have such an imbalance and we're facing such enormous pressures from greenhouse gas emissions and how that's affecting our climate. So I like to start off with that. We have a lab here, and I'm going to use this opportunity to mention it. We've just updated the website, so you can check it out. It's the Health and Community Design Lab. 2 full-time staff are there. We love to be able to collaborate with you. If you have questions, we warehouse some interesting data sets on built environment. We measure in great detail how walkable this region is and many other regions. So if you're interested in your research and knowing what the neighborhoods are like around, you have some participants, especially if they're in the Lower Mainland or if they're in Toronto, and some other areas. And there's other data sets available too that we can point you to. If you want to integrate that into your research and you think it's relevant, the environment, then let us know, because we can help you do that. There's also a bikeability index that Mike Brower, who just walked in, has helped create and has actually been published. Your bikeability index on WalkScore too? Bike Score. Right, so that's widely distributed. So we're really pushing this a lot, and I think there's a lot of opportunities. You can check out the website if you like. So I use this conceptual model to bring kind of clearly, as much as possible, how do we link the built environment with health and then cost? What we're trying to do is put these pieces together. We even have proposals right now that are actively being reviewed called linkages. We view these as linking together. Each arrow has effectively a set of evidence and data behind it. And that's what we do as researchers, is we're doing inferential evaluation, determining if there's significant relationships between multiple different phenomena that may have or may not have been tested before. In urban planning, we mostly talk about, so urban, you can almost think about this as a gradient from urban planning and built environment professions and science over into health and then into economics, health economics. So land use patterns respond to, in fact, there's an interaction where we build a rail line. So the questions about where to invest in public transportation or where roads get built have an enormous effect on where developers are going to build, because of course that creates access. We all understand this intuitively. It also affects land value, and it is pure, deep politics. No question. It's all about, so it's a lot of jockeying for money and figuring out, we're going to get is the money next big rail line going to end up in Surrey, or is it going to be the Broadway corridor? You read about that, and that's very important for the future of our region, and it's particularly important right now for UBC, because we're about to, right now it's active. We're discussing what's going to happen to connect. Will the rail line be built from the core over all the way to UBC? Will it stop halfway? And those are where we as a university need to get very engaged in that discussion. So basically, on the behavioral pathway, we care about how the design of transportation, what sort of modes we invest in transportation. Do we build rail? Do we build roads? Do we build active transportation when we build transit? Are there good connections for biking and for pedestrians to get safely to and from transit so that transit can function better, actually capture more riders, which is important for transit to do? Do we actually put development at the station areas? This has been a big issue in the media recently. Our station areas in Vancouver are actually the least developed station areas I've ever seen in most places. And I ponder, why is that? And I realize it's almost probably a manifestation of poor intergovernmental coordination, that there's usually, you would see, right above a transit station will be a lot of development because that's the most accessible point next to transit. So we don't have that here. And part of it, I think, is also we have a bit of a luxury in the sense that we have excellent transit ridership. People here use transit. We have a very multicultural, very international population, and we have a denser fabric. We have that land use pattern that is transit supportive overall. But at our station areas, we're kind of missing the point. So that's a way that transit and development should be brought together and actually is an opportunity for TransLink to make money. And I can talk more about that later. So we care about behavior, physical activity, and diet as it relates to the physical design of communities. What's nearby and what opportunities do you have? And how do you travel based on that, based on what that is? How does that affect chronic disease directly? So that's a relationship. If you're more active, they're solid. And in fact, I kind of view that in the central part of this diagram, there's pretty much reasonable causal evidence for most of these arrows. We have a report we did for TransLink that maps a lot of that out and actually takes each arrow and gives it a code and then unpacks the data that's around to date. So if you're interested, you can go to our website and see that. So, but we also know that there's a body weight. So most of the time when we apply to CIHR for funding, they're looking at obesity strategies for obesity reduction, built environments relevant, because through this pathway, through physical activity, energy balance or imbalance, chronic disease, well, the truth is that we know if there's systematic relationships between what we build, how people move around, and their body weight, chronic disease, then it's going to have a cost. And in fact, the cost could be huge. So what we want to do is get to this cost information, bring in POP data, BC data actually right now, and actually look at systematic relationships between chronic disease, onset, and cost in relationship to the design of communities and transportation investments. When a decision is being made by TransLink and regional governance structures and so forth about transportation, they use a model, a tool called a cost-benefit model. And many of you get trained and probably know. How many have ever taken a class that included some cost-benefit analysis type of accounting? Pretty in engineering, it's like core stuff. That's what they do. Well, the cost-benefit models that we have, they're good at measuring in some ways what they're only good as what you measure. But if you're not measuring the health impacts or the health costs of the transportation investment, you have what's called a complete externality. And that's where we're faced. So they're looking at the costs and benefits of building this kind of infrastructure, a train line or a highway, not taking into account the life cycle costs for that highway will be there for, well, the Portman and the Highway 1 widening, all that twinning of the Portman, we spent $3 billion so dollars. No thought given or really expression about the long-term cost of being sedentary, promoting a mode of travel, driving, increasing the utility of driving by making it more convenient, promoting sprawl, which is called induced demand. And this is the transportation literature. And that's just absolutely, completely not even looked at. It is interesting because, in effect, those costs might be greater, and I actually think they probably are, than even the cost of the road or the bridge or the highway or the train line itself. So the externality might even be greater in magnitude than the actual infrastructure that's being discussed. So this is interesting stuff for that reason, because from a fiscal governance perspective at the provincial level, if you look at the projected rate of increase in chronic disease and healthcare costs, this is part of it, and maybe a big part of it. So that's why it really is, and in fact, it's very interesting because we work, and I'll get into talking a little bit about this in a minute, taking all this evidence we've been collecting over the years and build tools that actually predict some of these outcomes. And I can tell you, in some of the regions we've worked in fact, most of them, when you bring this evidence forward and you sit around and look at the people's face who are on the decision boards for making regional transportation decisions, the rooms get very quiet because there's no question what we're talking about is a major shift not a nominal 1 or 2% shift out of roads into active transportation modes or into transit, a significant shift, maybe 20, 30, 40%, really, really moving the dollars around. The exposure pathway is critical, certainly for understanding the costs as well. Travel patterns affect, the generation and exposure to emissions, which affects respiratory function. And this path, and also noise, which is very important. And this pathway is, I think, more researched historically, perhaps, than the behavioral pathway. If I'm correct about that, but there's been, so typically in an environmental assessment, you'll see more on air pollution exposure and noise than about, the belief, because we don't have good causal evidence typically about behavior and how behavior changes, and we're trying to get at that through more longitudinal study design. So this is a metaphor, a simpler way to think. Foundation is what you build, where you build it, affects behavior, that affects the quality of the environment and quality of life. And I actually use this for, I don't know if you've ever heard the term performance monitoring indicators. What we're trying to do is to get indicators built, and actually health indicators would be up here, quality of life, environment. So, and there's sets of indicators at each level, is to create what's called performance-based transportation funding. So we actually get buy-in. And the way you started off politically is to say, here's what we can measure, like the walkability surface or the air pollution exposure surface that currently exists that's been generated by Sarah and Mike, where that's actually really useful because that actually creates a baseline set of indicators, and then we could track over time how well different jurisdictions are doing on how populations are exposed or not exposed to risk, or to health promoting or health protecting or inhibiting adverse environments, and use that as a way to allocate funding in the future. So we'll say, we'll give you the transit investment that you asked for, or the transportation dollars that supports your economy and your ability to grow, but you show us over time that you're making changes in your planning and in your decision making as a community so that those health benefits and the economic and other benefits, environmental, that will really happen. And so the way you start off is just measure it, and you say, oh, we're just going to measure it, we don't, and then you don't push the dollars, don't attach dollars right away, but once it's measured, then you can start to, and we have here at UBC and in our programs here, baseline data for many of these indicators to be started. And that's, I think, a good point of entry for governance. I think I talked about most of these points already, but aging populations are a really critical part of this whole discussion now, because we have more and more people that are sensitive to air pollution as they age. And the cost of healthcare service delivery for seniors, something that we need to measure more in sprawl and automobile-dependent environments versus in more walkable places. So from a case management perspective, how are you going to get to everybody you need to get to when in fact they live in very dispersed? Or what about demand response? Someone has an emergency and they live way out. So communications around that and dealing with that issue is becoming more and more important. And then globally, many of you may study global migration patterns from a health. How many of you are studying global health? Is there any folks that focus on that topic particularly? I should have asked at the beginning what you all studied, and I designed my talk better. But anyway, so this is a big issue because more people are moving to urban centers and are exposed to many of the ills of urban environments. So I use this graphic a lot as well. I think a lot of you have not seen it. So this is the way we do the study, the way it's designed and measured, the way the built environment relates to our, we want to be, and this is called an ecological model, where we care about, we want to simulate the actual opportunities that people have when they walk out the door of their house, in this case, or it could be where they work. So if you live here, this little squiggly line is what you can get to. And we use GIS, Geographic Information Systems, to build this, automate this little, because this little pod here was something that one developer and another developer, they all did their little subdivision, and they laid out their streets using cul-de-sacs. That was the standard or template for that area. And you can see that if we were to say, well, your world is the radial sphere, what's wrong with that? We would assume that, okay, we'll go out a kilometer and then draw a circle and then pull in all the information about the destinations that someone can get to within that radial area. Does anybody know what problem that would, why would that be problematic? Why would that cause error? Right. Their wings are down, right? We haven't gotten there yet. It's called crow fly distance, but we're not crows or birds. We're on the ground. With network distance matters because we are on the ground, right? So that's our network distance. So even though something could be close by over here, let's say this was a commercial destination, this were shops and services and employment, you can't get there. You got to go all the way around. And it was designed that way, and it's actually based on a paradigm that led a lot of development, which is a reasonable notion. It's called defensible space. There's actually a guy named Oscar Newman who became the head of housing and urban development, or very much a leader in the US, and basically created this template post-World War II that took off. And it's simple to build, and it's cheaper to build. And when you take the sidewalks out of the calculation, it's cheaper because it has linear footage of roadway is the least. If you look at a grid, like here, there's more lineal footage of roadway and infrastructure in a grid, and it could be 5% difference, but that 5% is the 5% that could double the developer's profit. You know, you're talking big money, so it costs a lot of money. They only take away 2%, but they, you know, we're talking, it could be, you know, 10 million bucks or 20, 30, maybe much more. So anyways, you see this is an unwalkable place. We call this less walkable because it's single use, so there's no complementary destinations nearby. You got to travel further to get anywhere. This is multiple use or mixed use. And the buffer, see why the buffer's bigger is because it has an integrated grid. So you can get around. More simply, this just says the point. So there's proximity, how much stuff is nearby, and then can you get to it directly? You can have a lot of stuff nearby, but if you can't get to it, what's the point? You would be surprised at how little research until even just 3 years ago used network buffers. Most of it, in fact, they thought it was a big advancement to use crowfly buffers as opposed to having the, quote, modifiable aerial unit problem. Anybody have any geography background? In geography, basically, they beat up, you know, census geography is arbitrary units. So most of the time, researchers just use census tracts that have, you know, just basically are designed and defined by roadways, blocks, and so forth, but large areas. There's a lot of problems and error introduced, so it matters to know what people can get to and what opportunities are within that space. So basically, built environment data sources, we use a lot of data from assessors, from parcel data to measure residential, all those land use measures. Things like roads and trails, bike facilities, and sidewalks. These are data layers typically available through regional sources. Ministry of Education for schools, transit agencies to know where the transit stops are. We also need to know regional accessibility. Anybody ever heard that term? So walkability measures how walkable your neighborhood is, right around your house. What about where it's located? What if that very walkable little place you have is way out in the edge of the region, where you have to drive really, really, really far to get anywhere? That matters too. So we capture that through the transit agency and through travel demand models that are used by transportation agencies to predict how people travel and where to invest in transportation infrastructure. So we capture that. That's travel time to and from all the destinations in the region. And we extract the travel time based on time of day. So in the AM, you have congested flows going from, let's say, downtown to UBC. In the PM, we have a directional flow. If we wanted to go from UBC to downtown in the morning, it'd probably be pretty easy. I bet the buses are pretty empty, right? So we got to know if you want to predict how much time it takes to get from A to B, you have to know the time of the day. You have to know the congestion level on the facilities, and that's all provided to us through that source. Census data, obviously critical to all this research. We like to get data on other factors, such as where there are farmers markets. We like data to know about crime, moderating effects, for example, of relationships that otherwise we would misspecify or miss. In fact, if we don't capture social phenomenon, such as crime. Public health, such as other food locations and so forth. So there's a lot of different types of data that come together. So here's an example of comparing two communities, Moody Park, uptown, right next to each other, more, we call it walkable, and Queensboro. Now, somebody living in Queensboro will tell us in a survey that we do that my neighborhood's very walkable. I can walk on my street in this neighborhood, and I don't have to worry about a car coming by and hurting my kid. And we see that. So there's a whole parlance, kind of a dialogue problem with a lot of the terminology that we apply. So we're embedding our values when we call this, but this is what we see. This is where we see people walk for utility. They're walking to get places. We can substitute a car trip for a walk or bike trip over here. Not over here. They'll walk for recreation in their neighborhood. And we see that happen. So, density, mixed use, we have values for each of these factors. We roll it up into an index. We use Z-scores or Z-scores. I'm half American. I became a Canadian citizen almost 4 years ago, so I know now. So anyways, you can see that, and we have a distribution, and this is kind of a cool measure, this last one. This is the one that captures the urban design effect, and this is whether or not buildings are built up to the street or set behind a sea of parking. And that's called a floor space ratio or floor area ratio, and it's just simply the ratio of the square footage of how much stuff is on a site versus how big is the land. And when you divide that, you come up with something that tells you if there's a lot of, if there's a low FAR, means you got a very automobile-dependent urban form, and a high FAR means it's fairly walkable. You'll get that? And that's really important because that's what zoning does. So any house or any building in our region has an allowable FSR. They'll tell you how many square footage you can put on that site. And so because it's regulated, we can then speak directly to the policymakers who set the regulation saying you should increase the FSR or allowable FSR in this part of the region or this location because that's going to make and promote transit use. Here's what our region looks like. This is the new walkability surface developed for 2011, and this is a data source that's available. We have one for 2006, and we've done some change detection to look at the difference between the two, and that's a report that we're just about to release. So you can just see in general the more walkable areas are in these other shades where the urban cores are. There are some other areas. New West is very walkable, and Abbott, there's even some other little pods out in the rest of the region, but not as much as our central area. This is San Diego, showing I've done a whole lot of work there in the last couple of years. San Diego appears to be very liberal when you go visit it. It's a very fun place to live, but if you ever get involved in research there and get it, it's a very car-dependent, very automobile-oriented culture, extremely. They got federal dollars to fund this research, and they would not even want to release it. They absolutely are furious that we proved that building sprawl is bad for people's health there. I had that happen in Atlanta, and I thought, well, Atlanta I can understand, but I figure San Diego would be more progressive, and I think Atlanta's more progressive than San Diego now. So that's my new story. Anyway, so this is a walkability map of San Diego built at the census block group. That's the same as, I think, a DA, a dissemination area. It's a subset of a tract. It's like a neighborhood. And you can just see the variations and gradients of walkability. We have a whole report that we developed on San Diego's health. So the evidence to date is built environment obviously plays a role in shaping health outcomes, we believe, through behaviors and exposures. Environments relate with health outcomes independent of preference or self-selection. So this causation is a big issue. And part of the problem with causation is not only the ordered stimulus-response relationship, do people change their behavior when changes are made, but we self-select. So people living in walkable neighborhoods are there and would walk more anyway. So there's a lot of evidence now that you can cross-sectionally tease out self-selection. So when I talk about cross-sectional, you all understand or follow what I'm talking. So one time point, we're comparing the same different people in different places, and we don't know anything about how their behavior would shift. We don't have a pre-post, like before and after a change is made kind of a design. Does that make sense? Okay, so that's where the evidence is getting hung up. Causation requires us to do two things. Cross-sectionally, we can ask people their preferences, and I'll get into that in more detail now. And then look at how people who have similar or different preferences behave in the same kind of places. The upshot of it is that if you live next door to a person that prefers to walk more than you, that person will walk more than you. But if you both move to a less walkable place, you'll both walk less, but that person will still walk more than you. In other words, we respond to our environment, but we also have preferences that shape our behavior. So statistically, it's probably going to be most interesting to look at the interaction between preference, attitude, and physical form or opportunity. And that's really kind of we're about to get into more of that. Meeting physical activity guidelines and reduced risk of obesity are associated with, notice I don't say are a function of because we don't quite have enough handle on causation, associated with transit use in more bikeable and walkable environments. Whole bunch of new research in the last 10 years on the effect of transit use and building transit and health. And that's really great. So basically, building transit is a supporter of public health. Reduces odds of chronic disease onset for several morbidities. Now I've slipped up there and I use the word reduces, meaning I'm inferring causation is associated with. There are 3 studies now that show causation, so we're getting there. Logically reduces demand on healthcare systems, so it's both possible timely to monetize the cost. Here's some new stuff that we've been working on a little bit more lately, which I think Mike would find interesting. You probably already know all this, but obviously, vegetative impacts on human behavior and health theories, well, obviously one is biophilia. Humans have an instinctive affiliation and need for connection with the natural world. E.O. Wilson, anybody ever heard of E.O. Wilson? Ecologist, from Georgia, right? Very interesting from Athens. His work was tied to I think he may have worked with Rachel Carson in Silent Spring when basically they were working in the Everglades. Then there's this attention restoration theory. Exposure to nature can improve directed attention and reduce stress. Now, I think Olmsted knew that. That was what he was thinking in 1860. He understood that, argued passionately for parks. And then there's nature deficit disorder. The lack of exposure to nature is associated with behavioral development and physical disorders. And then there's some studies now that are ferreting this out. Physical activity, and there's some studies along a few different pathways. On the physical activity pathway, converting vacant lots into park-like settings led to increased self-reported physical activity in Philadelphia, in a study. Adults are more physically active in neighborhoods with park or other green space access. We're seeing lots of studies on this, actually, more than we're showing. Children spend more time playing and being physically active in areas with more trees and vegetation. Maybe, I don't know if any of the new studies that have been done here unpublished so far maybe fit into this. On the body weight side, increased physical activity in green sets. So some have extended down that pathway and said, so increased physical activity in green settings, hypothesized to help reduce body weight. End of a 2-year study, body mass index percentile and the change in BMI percentile were lower for a county in Indiana, children living in neighborhoods with more vegetative cover. When studies come out like this, there are so many factors that we have to take, that you would look for to take into account to see what the food environment was. There's a demographic context, so really important that that this is taken with a little bit of notion of other factors. Higher level of neighborhood vegetation, greenery are associated with lower likelihood of being overweight or obese in adults and children. So some on that. Now further out on that causal pathway, looking at morbidity. Type 2 diabetes and cardiovascular disease, increased physical activity in green settings is hypothesized to help reduce chronic disease associated. So very limited evidence for diabetes. More green space near the home was associated with lower, someone showed a relationship, maybe with Louise Moss, or maybe here. Conflicting evidence for cardiovascular disease. This is interesting. Some studies found an association between more green space and reduced cardiovascular disease, while others have found no association. So these are early days for this kind of work. And the pathway gets kind of, a little bit circumspect the further you go out. But clearly, there would be a logical relationship between having amenity and green space in your neighborhood and being more active because it's an opportunity. Then there's a question, is it the destination as a green space or having corridors that have nice vegetation along the corridors and how vegetative cover or tree canopy and the location of trees. And we even just, not shown here, we just correlated, how many have heard of accelerometers? Anybody know what an accelerometer is? I'm going to ask you, what's an accelerometer do? That would be a good definition of it. No, that's literally, It measures it measures activity levels. I don't know why we call it acceleron, but it's the rate of motion. It's so it's actually a gyroscope. So its core definition, but its output is objective measure of physical activity. We've been using it that way. We have not been measuring rate of acceleration, but it is using, and maybe literally that's maybe the most most accurate possible definition. Way to go. So that device is an objective measurement of physical. So as opposed to asking someone how active they are, we equip people with these devices they wear on their hip for a week to get a solid reading of it 2 times a year, so you don't get the weather. You can overcome the weather effect to see, because if it's raining, they may walk less and so forth. So that data we've just correlated with things like trees and found very significant relationships with even spacing of trees. The people who live on streets where trees are evenly spaced, where there's good tree canopy and sidewalk coverage or shade pattern, that's highly associated with objectively measured physical activity. That's new. So that'll help us, because we now understand there are some relationships. Things like sidewalk evenness, seating, and other things. We're starting to detect these signals within the sample. So psychosocial health. Well, this is a one that Emily Rugel, I mentioned my PhD students, particularly interested in, is looking at how, and this is a direct path, makes a lot of sense of how people feel associated with reduced stress, better mental health, reduced depression and anxiety, greater self-efficacy and self-discipline. I don't quite know how that research design came out. Anyways, reduce attention deficit disorder, or ADHD. Increase neighborhood social capital. There's a logical relationship there. Having space to gather in a neighborhood where there's a pleasant environment could be associated. Definitely highly correlated with SES income. We do know there's better vegetation and even tree spacing in neighborhoods where people are wealthier. So teasing that out is important. And then reduced crime. It doesn't mean, though, that if you plant trees, crime is going to go down. That's not the best strategy for for crime reduction is plant trees. And it, so you have to sort of understand these are packages of factors, and when researchers look in this, it's just an association. It's part of the package. Asthma. Complex. Some studies have found reduced asthma morbidity in areas with greater tree canopy, hypothesizing that certain trees clean pollutants from the air. I'm not an expert on this. Maybe Mike wants to speak to that. I don't really know that seems very, very implausible to me, unless it seems it has to be a mechanical, where would have to be a very dense, like super dense hole, like edge right against a road. I don't know. That's all I can think of with that. And then he's not saying. But certain types of trees generate, and this is the confusion, is that we're sure, though, certain types of trees generate pollen that are associated with increased asthma prevalence and severity. So when I'm working with a tree foundation in Sacramento and I raise this issue, they're like, well, it's, you have to think about all these different factors that play different roles. Well, evidence is very limited on tree collision. There's argument to have trees close to roadway edge. Traffic engineers have a different opinion on this. Evidence is several studies indicating a reduction in vehicle collisions on roads lined with street trees. These studies hypothesize that trees help enclose the driver's view and have a calming impact. Well, arguments could easily be made in the other direction, loss of visibility. Other relationships, limited evidence. Better self-reported general health, reduce ultraviolet exposure. That does make sense. Reduce heat stress, faster healing recovery. That's interesting research on that. There's been a lot of work, and I think that's based in biophilia, where people on one side of a hospital corridor versus another have done better, where they were able to look out at green space. Lower stroke mortality, seniors' longevity, higher birth weight. All these are other factors. So one of the things, and that's those were pulled together by a colleague of mine with me, Jared Ulmer, who's doing his PhD on that topic at the University of Washington. One of the things that is interesting with vegetation, though, it just seems like that's an understudied area, so that you'll see more research on that. Transit use in physical activity. This came out of Hugo LaChapelle, who was a PhD student of mine, who's graduated now. Found people who use transit in Atlanta were almost 3.42 times more likely to get the amount of physical activity they need than those who do not, all else being equal. So the odds of meeting a 30-minute activity recommendation of moderate physical activity is negative declines for additional trips as car driver when compared to moderate walking. So we start to see that relationship between car use having a deleterious effect. There's new evidence, and I'm just going to summarize this to move ahead a little bit more quickly, but there have been some pre-post studies. This one was in Charlotte, North Carolina, where they sampled people before and after they opened a rail line, and these folks published an article in the American Journal of Preventive Medicine with a profound effect. Seems alarmingly large, but riding the rails can leave users on average of 6.5 pounds lighter than others and 81% less likely to become obese over time. They only had 2 years of data, so I think they really kind of were able to push this, or 3 years time. So timing of exposure is key, and it seems quite an effect to see. I would expect to see changes in physical activity, the behavior, but I wouldn't expect so quickly to see changes in weight. So that's kind of amazing. So that's one of the first studies. There's 3 new studies out that are now publishing on that. So earlier on, we linked accelerometry data with built environment features and showed people were 2.4 times more likely to get recommended amounts of physical activity if they lived in the most walkable parts of Atlanta. This was before I was here, I was a professor in Atlanta. And this is more the important part though, is that only 18% in the lowest, and in the best case scenario, 37% actually got the amount of recommended physical activity. So even under best case scenario, just over a third of that population actually get the recommended amount of physical activity. I don't know. I wonder how much better we are. Probably a little bit. So here's built environment characteristics explaining walking in adults. And basically the point of this slide is that walking as a mode of travel is highly sensitive to all these factors about neighborhoods. It just shows degrees of significance using a travel survey here in Atlanta. Master's student of mine, Andrew Devlin, did this. So density, you can see. But what's different is that people will walk. This is for utility work and school to get to work versus other purposes. There's differences in relationships of why you're walking. This is a study that I've presented a good bit over the years. This became known as the driving makes you, it's a study that shows how obesity is related to a built environment and time spent in cars. So the older we are, the more time we spend in a car. If we're a black male or female, we're more likely to be obese. If we're more educated, and a separate effect, and this is interesting, that income and education have a different effect on obesity. Distance people walk obviously reduces or is associated with less. And living in a mixed-use environment, or if they're a white female versus our referent is a white male. And then we learned that the white, so you look at the effect, well, the T ratio is greatest for this. That's erroneous, and we actually saw that white women underreported their weight. And we don't know why. So that became a big part of my joke line telling this. This was the study that got a lot of attention. It was kind of an interesting study to do. So each additional hour in a car is about and this actually been replicated in Australia, maybe 6 other countries, and all the results are very similar. And what's interesting, and I'm trying to learn from you all and being in population health, is how to overcome the reaction is, 6%, that's nothing, and I think it's how you present the number. We could do a relative risk that probably would increase the percentage. I chose not to because I thought the absolute was better. It's more, clear. But 6% washed across the entire population of 4 million people in Atlanta is a pretty large number of people. So, and then you extend that. So there's as we're getting into using tools that are now being applied in practice, the reaction is the planners are nervous about using the tools because the percentages of shift are low, yet the significances are extremely high. Like, we're very confident that 3 to 5, maybe 8% reduction in diabetes might occur if you built an area in a more walkable way versus not. But people look at that and go, oh, it's only 3 to 5%. It's not really worth doing. But there could be 4,000 people living there. So what's 3 to 5% of 4,000? And you end up with how much does a diabetes case cost? Like, what is the cost of that onset versus not? So these are questions that we're really in the middle of grappling with. So an hour in a car, 6% increase. Walk a kilometer, a 5% reduction. Just a kind of a little cartoon that got put in the paper at the time in Washington, D.C. Kind of characterizes it, kind of fun. And it made me think of the Flintstones, because what's the answer if we're going to be driving all the time? We have to self-propel our cars. And then often I like to talk about, well, what's happened with the research since then? And I think I'm going to try to wrap up pretty soon. I won't present the whole thing, so there's time for questions. I want to make sure there's some time for. Okay, thanks, Sarah. So there's been a lot of interest in youth and in elderly because they're more sensitive to built environment, don't drive, often have less mobility options. So for youth, we care also because there's a creation of behavior patterns establishing, like I argue the U-Pass. I'll have an op-ed come out next week for UBC on the U-Pass and why Broadway corridor is important. And TransLink doesn't like the U-Pass because we negotiated a really good deal. U-Pass, they lose money a little bit on the U-Pass. But maybe they're not measuring it right because there's a health benefit and there's a ridership installation, creates an opportunity. There's all kinds of benefits that come from having that incentive. So basically that's part of it. Well, for kids that live in more walkable environments, we see 5 to 8, 9 to 11, 12 to 15, and 16 to 20. So these are the sample sizes. So we had a really large sample of kids. And we looked at how each of these factors related with if they walked in their neighborhood. And we controlled for demographic characteristics. Well, having a park or some open space near their neighborhood, no matter what the age range, was the only factor that was significant in predicting walking in youth. Interesting. When they get to be 9 to 11, we see density starts to matter. And all that's picking up is the distance to school, proximity to the nearest school. In fact, one of my students looked just at that factor and looked at the microenvironment, the quality of the pedestrian link. Actually, we went out and walked the streets and looked at the sidewalks and the crossings. She found nothing. Came back almost in tears and said, my study's worth nothing. And what it was, I said, why don't you go out and just select out half a kilometer. It was this age group. Look at those half a kilometer or less, and then the pedestrian environment may matter, and it came out to matter a lot. So it's just distance to school, which has an important policy for how we build our communities around schools, how the density is there, having a variety of housing types, as well as school siting, not allowing schools to go out really far away from the core area if possible. 12 to 15-year-olds, everything matters. We see all this, so that's the age range that very sensitive to their environment and everything else. So you can see very high odds ratios. So everybody here, I'm sure, knows what. Anybody? So the way you interpret this, just in case there's someone who wants to know what this means. So what this means is for those, there's kids living in the most dense neighborhoods, 12 to 15-year-olds were 3.7 times more likely to walk. That's all the odds ratio. So you can interpret this as a factor up. And then when they hit 16, well, it starts to reduce. The relationships start to erode. Well, become able to drive. So that led to an analysis like this, where basically using the same data, we know vehicle ownership. So I'm thinking, well, okay, access to cars might be, it takes a long time to rebuild communities. But if we were to change our policies around the cost of insuring vehicles or using cars, we actually might have the same effect we're looking for, and it could happen quick. And that's what elected officials want. They want quick results on their watch. So basically, compared to youth from households with 3 or more cars, youth from households with 2 cars were 40% more likely, or 1.4 times more likely to walk at least once over 2 days. If they were from a 1-car household, 2.6 times more likely to walk. And then so forth if they have no car. Well, they have to. Right? It's not fair, but we do it anyways just to make the point, because it's fun. And that's why, statistics can be boring. We have to find ways to make our lives known. It isn't boring, actually. Pretty interesting. So what could we do about this? Well, insurance often makes additional car ownership and registration is silent to how many cars people own. Maybe we could do something about that. Maybe we could say how many people you have in your house, how many cars you have. And we could then determine what the registration cost should be. ICBC deals both with the cost of registration of vehicles and with the insurance of their use. So there's something, how many have heard of distance-based insurance? Anybody ever heard of that idea? So this is, I'm going to ask Barbara, would you describe what it is? George? Right, you pay as you drive. So if you don't drive, what it does is it converts the effect of the cost from a sunk cost. So I pay my auto insurance yearly, just to get it done, or half year, whatever. But if I weren't to do that and actually know that if I don't drive, I don't have that cost, it converts the cost from a sunk cost to a marginal cost at the event or decision when you're deciding whether or not you're going to drive that day. That's the key, is that we need to create all kinds of mechanisms that shift the decision to the individual at the event. So it's more related that way. And that's what distance-based insurance would do. So we're having trouble getting traction with ICBC on this. We've tried for years. We've had like 3 or 4 goes at ICBC. Just in the paper today this morning paper was about ICBC as a cash cow for the liberals and so forth. But we have some opportunities there. So I think I'll just conclude and mention that aging population is going to be a really big part of a lot of this. This is an example in California, but in most urban areas, population of seniors is going to double, if not more. And where will these people want to live? They're already showing urban areas are becoming more expensive. Walkability is becoming a premium. So in conclusion, this is really kind of an area where we have a bit of a market failure. We don't deliver the supply of walkable environments relative to the demand that they exist now. Even in this region where we have a lot of walkable places, the reason they cost so much is because they're basically in high demand. So we have to get our heads around that and start to build to match the supply and demand better, and that will be a way to bring the cost down. It's undersupplied. So more on that, and I think that's a good time for me to stop, and thank you for your attention.
Thank you very much, Larry, for such a great start to the year. Do we have any questions? None have popped up online yet, so we have the chance to take some from the room.
So Larry, on the last point you made on the distance-based insurance, I mean, there is sort of a model that's becoming more and more popular that's similar to that, which is car sharing. And I wondered what, if any, evidence there is actually on the relationship between people who use car shares and physical activity. I know personally it does increase it, but that's just N of 1.
So it has increased your walking. Right. Did you give up ownership of a car and join car sharing?
A hit and run driver did. So. Did it for me. Yeah.
So there was car elimination. Fortunately, you were okay. You weren't in the car. So, there's not been a lot of research on car sharing. There should be more. There's definitely a huge opportunity. That's an intervention where car sharing takes off in a region, and I've wanted to, but it's something we haven't been able to do. And I've seen surprisingly little evidence on car sharing and its effect on behavior. It's clearly a corporate opportunity. There's a lot of money to be made in it. We're going to see more and more of it, to the extent that companies that are investing in car sharing, I forget if it was Hertz or Avis, I would predict you'll watch their stock go up. It's a big market opportunity. Effectively, it's renting a car, but in a more simplistic way. And so that is going to be more the norm. And I wish I had a better answer, but I think it's something to have some exploration on. I'm surprised at how little and I know that you and, Kay in particular and Megan are working on bike sharing, and other researchers are interested in that. I haven't seen as much on the car side. Other questions? And if you'll say your name, and that'll be good.
I'm Jasper, and I was just wondering what your thoughts are on the development in New Westminster with the new station and the towers above it?
That's great. Actually, they're working. So that's to be credited as the municipality, New Westminster, the municipality. Now remember, New Westminster is very small geographically, and it's fairly dense, fairly walkable. So to them, that station area is a no-brainer. They have to develop around it. There's a little more luxury within the city of Vancouver where we have the Canby corridor. There's a little bit more space. So I think that's going to be very successful. The project probably was a good place to invest in because it's only going to, that's your safest bet long term because of energy cost, because of unmet demand for walkable environments, because of demographic shifts, aging population. You're going to have to live in places where they don't have to drive. Attitudinal shift of the your generation is huge. We even see that folks in your age group aren't getting licenses, a significant reduction, and you probably read about that. So collectively, that's we're going to have to do everything with the station areas above along the Canby corridor. Those are worth a fortune, and they're just sitting there, like vacant. So I think obviously New Westminster's planning director and the developer worked together. That's called joint development, and the challenge of it, why we don't see more of it here, is it requires the timing. The developer wants to get something done fast. Time is money to a developer. Transit agencies and government move very slow. So that's very frustrating and difficult. They can lose money on it. So if they can wait it out, that'll work. So that joint, we call them in Canada P3s, private-public partnerships, but that joint development model is well and live and well. And usually in other cultures, well in the US, there are incentives for them to work together, and it has to do with sort of the way the taxation and structure is done to promote that.
I have a question from an online audience member, Christy, who asks, is there an ideal ratio of green space to housing and business, or has the research gotten that far yet?
Not that I know of. I asked Mike if he's seen that. I don't think so. I don't know how that would be. Well, green space. There's also the question of how green space is measured. We're talking about, having good tree canopy versus park space. Is the question on actually the provision of acres of parkland per capita?
Yes, that's the question, but it wasn't specified.
So there's a whole history in urban planning called adequate public facilities. And in fact, that's basically goes back to a 1967 court case in New York State, Ramapo, New York, where legislation was passed and planners follow now, where there's a number of fire stations or police and schools and teachers per capita, and one of the dimensions of that adequate public facilities is green space. So we could refer and see if there is any kind of a way people have tried to put a value on that. I doubt it's very well evidenced, and it probably varies hugely by a number of factors. Mike?
And there's been so it's not just sort of area. So there's access, there's quality, and in fact the size matters. So there's a few studies I've seen showing actually, so big green spaces have different draw different populations than smaller green spaces. So it actually depends. And you can just sort of see that. So Stanley Park is not really like a neighborhood place to go, but that's a lot of green space versus a small neighborhood park. So there's quite a difference, and sort of depends on what you're trying to do, actually.
That's a really good point. The type of activities that there can be active, recreation. I live in a neighborhood, just moved there a year ago, where there's enough space in the park near me. It's Douglas Park. Anybody ever know? Yeah, and it's so wonderful that I'm now going there every day I can just to run, because there's activities, there's sports. So that size is it's a kilometer around the perimeter. So that's a big debate in planning, is you have X amount of dollars to spend on green space. Should it be spent for lots of little parklets or small parks where you have short distances for everybody to get to a place to be out? Could improve social capital, but is that the best strategy? And then you have the demographics of the neighborhood. So if you have maybe a lot more elderly, maybe that could have a benefit. But then we also elderly like to sit and watch kids play, and mix the age group.
Okay, guys, let's wrap it up since we're at the end of our time. Thank you very much, Larry, and a big round of applause for our first speaker.
Thank you.